And I think we'll just proceed to the next speaker. His name is Marc. Oh no, that's a difficult surname here. Maybe you'll Aixalá. Marc Aixalá. He's going to speak on integration, so that's actually very logical after this talk, and a very crucial point in psychedelic therapy and psychedelic growth. Marc is an engineer and psychologist. He's a member of the GTT, the Growth Transpersonal Training Staff, postgraduate student studies in integrative psychotherapy. He's also an Aikidoka, an Aikido practitioner. He is academically formed in the therapeutic use of the non-ordinary states of consciousness. He has trained and coordinated psychological emergency assistance teams at many festivals with the Cosmic Care movement in Portugal. Very cool. He facilitates holotropic breathwork workshops in Barcelona and Switzerland. He works as a psychologist in Barcelona, and I think he's the first speaker who's not related to Imperial College in London. Clap your hands for Marc Aixalá.
Thank you. Thank you very much for the introduction. I am a bit nervous of being the first non-researcher, non-scientific person to talk this afternoon. So we've been seeing good science, and I'm going to be speaking now from a clinical perspective. So please, researchers, bear with me, because maybe my language is not going to be the same that you're used to, but I'll do my best to be able to convey the message. So I'm going to be talking about the issue of integration, which is something that has become more and more active, speaking in the internet. You can find like psychedelic integration coaches or counselors. Integration is all over the internet, especially around the Ayahuasca communities, but also around psychedelic psychotherapy. It's understood that integration is an important part of psychedelic therapy, but we know the word integration, but the concept of what we mean by integration is not that clear. We all say the word integration, but what does integration actually imply? So I'm gonna give you 3 examples of cases that I've worked with, and it is going to be somehow different from what we've seen before, because what we've seen so far, it's like statistical results from many people going through the sessions. And I was very interested when I was seeing Leo's slides. Now there was one in which we could see different subjects and the variations in the symptoms that they had after the experience, and there was a lot of individual variation. So then when we see the statistics, we see a decrease. But if you are working individually with that person that has an increase in the symptoms, that's a different story. So I guess that's what I deal more daily, with the individual cases rather than with the general perspective. So with that in mind, probably if you've seen any of my talks, I always put this the first thing. So bear with me again if you've seen that before. I think it's already acknowledged that there are 3 parts, which is the preparation, the session, and the integration. And throughout my practice, I've come to understand that integration and psychotherapy are different things. And I will show you an example in which that was before I made in my head that distinction, and I ran into problems or difficulties during the therapy. What I think is happening now in the psychedelic therapy world is that, in a way, it's like we would need to be good in all these 3 aspects. It's like the psychedelic therapist needs to do the preparation, the session, the integration, and the psychotherapy. But in the medical model, it's not like that. When you have an illness, you go to the general doctor, the doctor sends you to the surgeon or whatever, and then you come back to the doctor, which does the follow-up. So I think, and this has to do with the training of future professionals, both in integration and sitting for people under psychedelic experiences, we need to understand that the people that do these kind of interventions, maybe they need to be different people. Maybe someone that is good in doing integration sessions and doing psychotherapy is not good in sitting for people during psychedelic experiences. And there is nothing wrong with that, it's just different specialities. Same thing with shamanism, psychotherapists, we are not here to replace shamans. We can work with people that have had ayahuasca experiences, and then they come back to the West, and we need to be able to work in that framework. So I think that the needs and the qualities and the training that someone needs to run a session are different from the qualities that we need to do integration, and are different from the qualities that we need to do psychotherapy. So I think that in the future we're going to start to be seeing more subtleties in this kind of trainings, and each of us will find where do we feel more comfortable, where do we feel that we have more to give to the community in this situation. When we talk about integration, I like to make the distinction between two big situations. One is integration that is done to maximize the benefits after a session. Let's imagine we've had a beautiful session and we felt this mystical experience, and we've heard before, like after some months, that experience, maybe it was fading. So how do we do to maximize the benefits from that experience? What can we do? What tools do we have to make that experience to remain more closer to our awareness? And another situation is to deal with undesired side effects that we might be experiencing after an experience with any psychedelic or any method to modify consciousness. Most of the practices that are understood nowadays as integration, I believe that they belong to the first part, to the maximizing of the benefits, of the potential benefit of a session, which is the working through the cognitive material, the images, the archetypes, the emotions, like drawing mandalas, writing, sharing, all these kind of activities that work in the direction of promoting kind of solidifying the experience. But I think that there is not a lot written about, or thought even, about how to deal with undesired effects after a psychedelic experience, which they are different approaches, and if you only do the classic maximizing benefits activities, they don't work to deal with the undesired effects. So I'm gonna give you some examples from the second case, from when people have challenging experiences and they come to my office, they contact me because they have some problem that they didn't have before going to the psychedelic experience. Because a psychedelic experience can be a stressful situation, and to a certain degree, in some situations, it can become a traumatic experience. And some of the symptoms that we see after a traumatic psychedelic experience are similar to what we see after any traumatic experience. So a lot of people after a traumatic psychedelic experience, they have symptoms of acute stress disorder, like high anxiety, insomnia, intrusive thoughts. It's like the previous state to PTSD. So there can be a degree of trauma in the experience, a level of trauma in the experience, which is different from the content of the experience. And those levels should not be mixed, because trauma has a very specific manifestation and can be worked in a very specific way, and working with the content can be worked in other ways. So I think that if we try to deal with the traumatic symptoms of the experience by working on the content, maybe we are missing a point there. As far as I know, as far as I see it nowadays, there are two phases when there's an experience that has been traumatic. The first stage, the first approach is to decrease the symptoms of trauma. So to decrease the anxiety, the panic attacks, to promote a regular schedule so people can sleep, people can be functional. Because as we will see later, some people lose functionality when they go through these kind of experiences. And a later stage of the integration work is working with the content. But you will see that, or maybe not, but I tell you, some people after working with the anxiety symptoms, they don't need any further support to work with the content of the experience. Then we would be in the maximization of the benefit of the session. And some people feel, most people feel that they can do that on their own, and that's perfect. You know, I don't think that integration should become like a compulsory thing in psychedelic training or psychedelic therapy, as it seems that now it's becoming like the rule. You know, you need to do integration, you need to look for a professional after a psychedelic session, which I don't fully agree with that. So I'm going to begin with these case reports. I hope that I have time to show you 3 cases, 2 with MDMA and 1 with Ayahuasca. And they, as you will see, they are different in the nature of the problems that were present during these cases. So these paintings are from the patient. So I'm going to ask you for your confidentiality. Do not share these pictures or these recordings, because they have been kindly enough to let me use these for the presentations. So this woman, 39 years old, she was doing therapy with me. No, it's okay. Yeah. This one was doing therapy with me for a period of time, and at some point in the therapy process, she felt stuck, that she was not moving forward. I felt the same way. And she was reading the studies of psilocybin and MDMA, and she was very interested in that. So we were talking about that, and she decided to go look for a therapist and have an MDMA experience. So I did the preparation with her. I gave her all the information I could convey to her about what could be expected from the MDMA. She went to do the MDMA experience, and apparently the experience was well held. The facilitator was quite proficient, but the session was kind of difficult. The dose apparently maybe was a little bit too high for her. It was the first time that she was trying any substance at all. So it was a very, very impressive experience for her. There was a lot of anxiety on the come up, and all of a sudden she felt a sadness that she had not felt before. And she was overwhelmed by this sadness, but at the same time, she had the sensation that allowing herself to feel that sadness was the most freeing thing that she had ever done. She felt herself for the first time. So there was a little bit of ambivalence on that. The thing is that the session finished, and she still felt with a lot of anxiety. And so she called me when she finished the experience. She was very anxious still, and we talked the next morning, and she was still experiencing a lot of anxiety. She had a couple of panic attacks the next day, and she was totally afraid of losing control. So during the next week, I did 2 sessions of therapy throughout the week with her, because she was basically in acute stress. She could not sleep. She was afraid of the dark. She was scared of losing control, of losing sanity. She was doubting that she could go crazy, really. She could go really crazy, and she could not go back to work. She was so anxious that she had to ask for a medical leave for some days because she could not deal with what was going on. So in this situation, and she was reporting the content of the session. Yeah, I felt very sad. I don't know what to do with this. But the thing that was incapacitating her is not the content, was the symptoms, the physical symptoms that she was having. So during that week, the approach was to deal only with the symptoms, only with the anxiety, to prevent panic attacks, to allow the person to go back to a regular schedule, to sleep, and to find tools to manage the anxiety. So the intervention in this regard was very basic in a sense, not very deep psychology, more like symptom management kind of interventions. It seemed to me that the experience had not fully resolved, and there were still a lot of lingering things from the experience. So I proposed her to do a holotropic breathwork session the week later, so just 1 week apart from the session. And in a way, that worked well to reduce the anxiety that she was perceiving. So after the session and the couple of psychotherapy sessions that we've had, she was back to work, and she was still in touch with the content of the experience. She was still overwhelmed by what happened, but she could manage, she could go back to work. And then from there on, then we started working with the content of the experience. We started working with the sadness, where the sadness was coming from, what had it to do with the biography. And then a different process of integration began. But this first part of the anxiety or the emergency intervention, this could not have been done by talking about the biography, or it needs like more practical approach. The interesting thing is that she found that the experience was worthwhile, and after some time, she went and had another experience and another, and she had 4 experiences with MDMA, which at the end, what she said, well, what she say now, I'm still working with this person, she says that now like a new chapter of the therapy has begun. Now really my path in therapy has begun, and a lot of behaviors change, like the kind of food that she's eating, the kind of activity she's doing. She's going to change her job. She's studying again. So there have been behavior changes in her life. So this would be a first example of this anxiety management during the first stages of the session. These are some of the paintings of this person. She's very artistic, and she has this amazing notebook with everything that is going on. This is from the second experience she had. Yeah, it's been for her like a death rebirth experience. I mean, she's changed totally the lifestyle that she's having now, and but the whole thing took around 6 months or so, So it's not been like an immediate process. It's been more of an ongoing kind of situation. Okay, another situation. Someone that contacts me because she's having problems after having had a lot of ayahuasca sessions. I don't know this woman before, so the first time that I met her, she comes to my office and she starts telling me what she needs. She wants integration because of her ayahuasca experiences. So I start exploring a little bit what happened, and she went to drink ayahuasca because she had a lot of issues with anxiety, social anxiety, and she was not satisfied with the life that she was having. She didn't like her job. So she started in this spiral of, I need to heal in the next few months, So she drank more than 20 times ayahuasca in 5 months. And she had some psilocybin experiences and other stuff, So she comes to therapy and she tells me that the experiences are becoming more and more powerful, and that at the beginning they had to do with the biography and with the personal life, but after some sessions, it all becomes kind of transpersonal entities, energies, spirits, evil spirits moving. She loses control during the session and screams and shouts and runs away, and people need to contain her. So the sessions become very, very dramatic. But she continues using ayahuasca. It's like, in the next session, I'm going to solve what happened, because I have not understood fully what happened in this session. So the next session is the one that is going to cure me from what is going on. As we've seen that in the previous case, a holotropic breathwork session helped to decrease the symptoms, but in this situation is a little bit different. It's escalating in a way in which the person is losing contact with reality. When I explore a little bit more, she has a very tough biography, and she's had some traumatic experiences that she's not totally willing to talk about, but they come every now and then in the sessions. I did about 15 or 18 sessions with this woman for 6 months maybe. But really, what is going on with her? What happened in her daily life? Panic attacks. She cannot sleep because she's afraid that spirits will come and she will lose control. She's afraid of interacting with other people. So she reports being in her room, needing to go to the toilet and not daring to go because the flatmates are there, and having to wait for them to go away of home to be able to go out of the room and not meet them. So she was on the metro or the bus, and she's thinking that people are talking about her, that people know what they are thinking. She feels special connection with some guy that she sees that he and I were connected. We know what we're thinking. So she had this kind of psychotic kind of thinking. But so she knew that she was suffering, but she wouldn't really know the causes. I mean, why I'm suffering? What do my experiences mean? And this is and here, researchers, please be patient. This is an exercise that sometimes I ask to the person that come to work with me, in which I ask them to draw a rose tree. That's the indication. Draw a rose tree in whatever way you want. There's no more indications. It's as general as this. And this is what she draws, And then we talk about this, and she says that this is a rose tree that is in another dimension, and it's spiraling out with energies and connections. So it's a very kind of bizarre conception of a rose tree. So the work with this person was to, first of all, encourage her not to drink anymore, because every week she was coming with a new experience. It was like, well, yeah, if we need to integrate the 20 experiences, if every week you come with a new one, it's going to become more and more challenging. And then it was also interesting how throughout the sessions that we talked to each other, she would control a lot the sessions. She would check the time and say, "Now I need to talk about this." So she was the boss in the sessions. But every now and then in the sessions, there was like a crack in which emotions would appear, and she would start crying about past events, like traumas that she had, some situations of abuse. And then the work there was to start connecting the experiences that she had in the ayahuasca sessions with the pain that she was experiencing associated to the biography. And little by little, she started becoming more aware of what was bringing suffering to her in the present moment, which was, again, the job, the lack of a relationship, and the anxiety that she felt in social situations. So we worked to do this bridging and this grounding, and when we finished, or when she decided to finish the treatment, I asked her to draw again another rose tree as some kind of diagnosis, or these are my data that I show as a therapist. So this is the new rose tree. It can be kind of weird, but it's, in a way, it has root, it has some flowers. And so I explore a little bit more and says, no, but now this one is connected with another rose tree that is over there. So in a way, there's a little bit of a sense of grounding. I had the chance to, so she contacted me like 3 months afterwards. We did a follow-up session. She was doing okay, and she contacted me 1 year later, and she stopped drinking ayahuasca. She stopped doing any kind of mind-altering experience, and she had changed the job, and she was moving with a boyfriend to different cities, and she was kind of happy about her life. And she was saying, I'm still integrating what happened to me during that time. I was in a crisis situation, and all the information that I got from my experiences, I still don't know what to do with that. But little by little it comes, and I think that I'm going to have material for months or for years. So here you have another different case. And the last one I'm going to be talking about is, again, a woman that contacts me to the specific request of integrating an MDMA experience that she had 6 months before. So the interesting thing about this is that the experience was 6 months ago, so it's not very recent anymore. She didn't have an experience with other psychoactives. Maybe a couple of times she smoked cannabis with mixed results. And she has been with a psychotherapist before. So she comes to me specifically because she says, you know about drugs. So if I talk to you about drugs, you won't be scared about that. Okay. I explored the experience, and it was an unsupervised experience with a boyfriend. And she had a very ambivalent experience in which she felt a lot of opening, a lot of emotions coming, but a lot of difficult memories from her life. She had a difficult biography too, and she lost a brother some years ago. And then she's a medical student, so she knew all the reactions of anxiety, depression, and all that. So she's monitoring all the time what is happening to her. But again, at the same time, in that experience, she has, at the ending, a sensation of peace and serenity, and the experience that has been beautiful. So there is a mixed feelings about the experience. What happens after the experience? So that's a whole story of what she says, like hypochondriac sensations. She reads a lot about PTSD. She reads a lot about anxiety. She reads a lot about depression. She needs to do exams on psychiatry, and all that starts to trigger her the symptoms again. She takes a caffeine overdose, as she says, and she has an MDMA flashback again. So she has some flashbacks over the time related to some triggers that are related in a way to situations in which she feels physical sensations like the heart racing, or she reads or she hears about mental illnesses or mental suffering, these kind of situations. At a certain point, she has 2 anxiety attacks per day. So she was in some point very, very desperate. When she comes, she's not having anxiety attacks anymore, so she's stable, but she looks very confused about the experience. This is the family tree of the person. The brother had died 3 years ago. He was the younger brother, so it had been a very traumatic death. The parents are divorced, and they are immigrants from South America. They moved to Europe, so it was a very challenging situation also to adapt to a new country and a new language. What does she want? She wants to close the process that began with MDMA. She feels that with MDMA something happened, and that she wants to close that. Wants to be able to talk about this because she's very ashamed of what happened. She's ashamed that she took MDMA and now she's worse than before, so there's a lot of shame involved with that. And the interesting thing is that the boyfriend is a psychonaut. The boyfriend takes DMT, LSD, a lot of drugs, and she has a lot of ambivalence about the drug use of his boyfriend. So I have all the sessions described here. I'm gonna go, I don't know how I'm doing with time. 5 minutes? Okay. So I'm not gonna go in detail of the sessions that we did. But as you will see, I'm gonna point the issues that came out. So I explore the life of the person, explore the traumatic events, the brother died of a drug overdose. Okay, so drugs can provoke challenging situations. That's a situation that is being reinforced to her. I asked her to draw the rose tree. As you can see, same indications, different results. And one of the things that comes up with this is the strength of the rose. It's very rigid. I mean, it looks like a beautiful rose, but it's very rigid. It has it's like a tree, not like a rose, right? So I talked a little bit about this. So one of the things that she's very willing to explore is the content of the experience. So she reports in detail what happened. We work through that, and she's open to work through the content. At this point, we need to see that there is not a lot of anxiety. So she is willing to work with the content of the experience. But a thing that appears is that she has a lot of ambivalence between if she's going crazy or if she's being a good girl. There's a conflict between doing things right and doing things wrong. And that becomes an obsessive thought for her. Maybe I took MDMA and I'm becoming a bad person. I'm becoming some kind of person that I don't want to be. So I do some interventions to stop the anxiety. We work on the symptom level. And we also, there is one of the things that is happening here is that she's having a huge ambivalence between, should I have done this? What kind of people take drugs? What kind of people do not take drugs? My brother took drugs and died. I don't want to be like my brother. She had always been the good girl of the family. The brother was the junkie. So she was in a role of being the good one, but now she had done something that put her in the other pole of the situation. So there was a work with this, the identity and values to, in a way, not see them as two different poles, but if two different energies that can be dealt with that actually need to be explored, because maybe in this evil part there is something for her to discover. The thing becomes difficult when the attention of the sessions goes to the boyfriend. The relationship with the boyfriend is difficult, as you can see. He wants to use drugs, and he wants her to use drugs, and she doesn't want to, or she doesn't know if she wants to. The boyfriend wants an open relationship. She doesn't want that, but she wants to be okay with all this situation. And when I touch the issue of the boyfriend, she gets very reactive. So we have also relationship issues in addition to what we've seen before. Once we've explored, we made a session in which we did some kind of trauma work through the brother's death, which was very traumatic. It was an ugly situation. And after that, there was some relief from the sensation of, okay, I am becoming like my brother, or my brother was a bad person. So we work with if the brother was a good person for her or a bad person for her, because she was judging a lot also her brother. And there needed to be a lot of emotional expression. She cried a lot during the session. She got very sad. So there were kind of dramatic psychotherapy sessions. So there was also work on grief that had already appeared on the MDMA session, but she had never dealt there to look at, because she was like, no, my brother is in the sky. He's always with me. I like to think of him that he is happy, but she had not looked at the pain. But during that MDMA session, that appeared. And I don't know if you've seen before that the father had been diagnosed with terminal cancer. So she was in a very stressful situation also. One day, at the 9th session, she tells me, I was thinking of leaving my boyfriend before coming to therapy. So in a way, to me as a therapist, it's like, okay, one of the objectives that she had in this therapy was clarifying a little bit the relationship with the boyfriend, because the relationship appears all the time in the session. And she has this interesting dream that the father knows that the brother is going to die and accepts the death of the brother, and then she wonders that maybe she needs to accept that the brother is dead. If the father has accepted that, maybe she can do that, and then she sees the father for the first time as a positive reference. I can do something like my father without becoming a bad person like my father, who had been an abuser and all that. So this polarization is not so polarized at that moment. One day in the 10th session, she comes and she says, there is no before and after the MDMA experience. Yeah? So she said, I want to close the process of the MDMA. Now there is no before and after. So for me, that should have been a sign that was the moment to finish the relationship, the therapeutic relationship, to stop the therapy. But she was a little bit ambivalent of continuing or not, so I continued, and this is what made me realize that integration is not the same as psychotherapy. So far up to this point, she had made very clear that she wanted to work on the closure of the MDMA experience and the things that were related to that. But as I told before, when she touched the relationship issues with the boyfriend, she doesn't want to do that. But I make this mistake and I prolong the therapy. I offer more sessions. She comes, but those sessions, they don't go very well. There's no more interesting things to talk about the MDMA experience. She feels okay with that. She feels okay with her relationship to drugs. She's decided that she doesn't want to take drugs. She doesn't want to talk about the boyfriend. And I don't know why, but we schedule another session. And yeah. And then the session is not related at all. Things are going okay. But the relationship with the boyfriend is now the main issue. And she told me that she doesn't want to work with that. So I'm not skillful to bring this to a beautiful ending. And our therapy ends saying, you've helped me a lot with the MDMA experience. I feel that I've worked through that and I'm okay with that, but I don't want to work with this issue right now, and we're not going to see each other again. So I think that to me this was really a learning process in which we've really had a really good bonding throughout the whole treatment. But when I overstepped or was not aware of the request that she was doing to me, and I played the psychotherapist instead of doing integration, then there was a resistance, and I should have respected that and have kept the boundary and say, okay, maybe it's time to finish the therapy here, and good luck with everything. So, yeah. So as conclusions, integration is something that we're still creating. We use the word, but we don't really know what it is. There are different kinds of needs during integration to maximize the benefits and to reduce the undesired effects, and the interventions that need to be done in those cases are different. It's different to work with the traumatic aspects than to work with the content of the experience. So maybe there need different professionals to do these interventions, or maybe the trainings need to be specifically designed to match those needs. Here you have the contact information of our support service at the ISS Foundation, and my email if you want to contact me. And thank you very much.
Woohoo! Okay, thank you very much for that, Marc. Time is really a little bit overdue. I suggest we skip questions. Would that be okay with you? And somebody has like a really burning one over there. It's a long day, so we really need our breaks as well. We take one question then, okay? A short one.
Where are these MDMA therapy sessions happening?
Well, the thing is that MDMA therapy is not legal outside the clinical setting. So therapies that do that, they are underground. And there's this kind of groups happening the same way that there are Ayahuasca groups doing sessions. There's people doing MDMA sessions, but for obvious reasons, they do not advertise on Facebook or anything. So, yeah, I don't know. Some of them are psychotherapists, some of them are not. But I would say that most of them, they in a way belong to the transpersonal psychology field. But there are different profiles of people. Some are more kind of therapy oriented, some are more shamanic oriented. So there's different kind of people working. Yeah, but it's all on the underground. So I don't know.
That's also very much a topic we're going to touch on later at the panel debate, actually. The whole underground therapy and lack or maybe of trained therapists with the psychedelic therapy. Thank you very much, Marc. We'll see you in 10 minutes, 15 minutes.